Hey everyone, this month we're focusing on shoulder problems, and we've got Jackie here as our model, and I'm just going to talk about the most common presentation we get in our clinic, okay? So people normally come in with overactive anterior shoulder muscles and weak rotator cuff muscles at the back, and this normally leads to shoulder impingement and rotator cuff tendinopathy. So Jackie, can you just show us what a typical person looks like when they come in? Yes, so they're getting pain as they reach up overhead, like the shoulder catches, and they get pain right here in the front of the shoulder joint, okay? Typically, we would use a strength testing device like this to measure the difference between her rotator cuff muscles to make sure it's balanced. I'll just give you a quick sample. Jackie, can you push out? Push, 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 push. Okay, very good. You got 90. And let's do the other side. Push, 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 push. Ooh, 120. Okay, so she's actually got a 25% difference. So, I want to show you now some of the typical treatment techniques we would do for shoulder as well. So if you just follow us to the treatment table. Okay, so now I'm going to show you three of my favorite and most effective shoulder release techniques, okay? So we're going to release her pecs first. So we're in here and we're doing, this is called an active release technique. And it's very effective for improving shoulder range of motion and reducing pain. It's a bit painful. Okay. Second area we want to get to is actually in the armpit. So I'm going to press in here. Jackie's actually really tight in here. It's normally quite painful, but it's extremely effective. So I'm releasing subscapularis muscle, which is usually extremely overactive. Okay. And finally, I'm going to do some dry needling on the back of Jackie's shoulder, the rotator cuff. So Jackie. Alright, so we're going to use dry needling technique now to release Jackie's posterior cuff. Alright, so first we clean the area. We use the best hygienic practices here at Fine Form Physio. And then we're going to put needles into the most tight points that I find. So first one right here in the rotator cuff. And it's normally not too painful. Sometimes you get a little twinge or a twing, and it's actually a really good thing. That's the muscle releasing. And then once they're in, we leave them in for a minimum of 5 minutes, and then we readjust them in between, and that ensures we get the most effective muscle release. So this is actually a really tight spot on Jackie. You can see the needles bending. Very common area to be tight. It's a strong trigger point. Okay, so we leave them in and we come back and check on her in 5 minutes. So if you're interested or you have shoulder problems or you want to have some shoulder treatment, please, by all means, give us a call and come in and we'd love to help you. Alright, see you soon.